You. So this afternoon, I'm excited to be here. I've been out a little while. I know you'll agree. I just want to say welcome to my audience. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And thanks for the support over the years. I do appreciate you. I'm actually in another country at the moment, but I must say, time has been going, and I have to say something to my visiting audience and my regular ones. I do appreciate you. And as we're about to come to the end of the year, I just want to say I appreciate your support over the years and blessings. And I hope that we all have gained to its maximum, optimal things that would make us better, stronger, and of course be more informative, so that thus will bring about a transformative way of life, better, and just keep growing and be successful. And in so doing, passing it forward, paying it forward, doing it forward, and help others as we go along the path. So today, I just want to talk a little on leadership. Actually, there's someone who her expertise is in leadership, and she'll be coming on later at some point on my show. A woman of color, but has impacted so many lives. When we talk about resilience, when we talk about mentorship, yes, when we talk about resilience, mentorship, and leadership, and self-care and more, she has the expertise in those areas. And so today, I just want to say to my young nurses, I want to say congratulations to those who have just passed their NCLEX. Congrats, congrats, congrats. Great. But this is the beginning of it all, okay? So there's a lot of room for growth. But today, my question is, how can a new nurse develop her skills, leadership skills, within the early part of her or his career? There are a few things that we must embrace for that. Think of strong communication skills, active listening. We cannot overemphasize that. Active listening. Thank you. Active listening. You must be able to listen to your patients, their families, of course, your colleagues. It's so important. You must communicate clearly, because communicating clearly will definitely prevent misunderstanding and clarity and knowing the facts. That's so communication clear. You must be assertive. It's not time to shy around here and shy around there. You definitely should speak up and learn to speak up. It might not come naturally, because you might be saying you don't have that experience yet, but you're coming in with some new ideas. You're coming with some freshness. You've just been out the book, and there are things that are, I would say right at this time, present, current information that you might have even over some of the more senior nurses at this time for that particular topic or so. So speak up. It's very important to thank you for coming and speak up. Those are some pointers. Seek out for some mentorship. Somebody who have more experience than you, have wisdom, have gone the path before you. Try to get some feedback. Thank you. Try to get some feedback from others. It's important. No one knows it all, and this is how you will grow. You'll be able to, what I would say, the word, once you have that support and feedback, then you can embrace the things that will make you better, that will make you be a better nurse and be more, have the leadership skills. I'm doing great, thank you. I'm doing great. I'm doing great. Thank you. So take some initiatives. There might be a topic, there might be something on the floor that you would, I'm great, thank you. There might be something on the floor that, is causing, you're seeing recurrences of it. That's problematic. And you can initiate. Yes, you can initiate. If it's a little study, a little mini study, and you can initiate what you can do and get your other colleagues involved. And as a young nurse, doing that will help you also in the future as you develop your skills. Stay organized, organize your workflow. These are some of the things that are going to help you. Take responsibility. Don't try to shove it on someone else. There are times when you have to take your responsibility in hand. Be accountable, we would say, and learn from your mistakes. If you should ask any nurse or anyone, no one started without making some mistakes. Just be aware of that. There's no one, thank you. There's no one who has started out and have made any mistakes. So if the truth be told, we all have made mistakes. What are we going to do about that? We're going to make sure we connect. We're going to make sure we correct them. And we should stay educated. What do I mean by that? We stay educated, stay current, because we are living in the 21st century. We talk about constant change. We have to embrace being constant, because there are going to be changes every time. And sometimes as we're about to, I would say, embrace or practice this, because of the consistency in research and evidence-based practice, and as they go. Remember, the nurses or the clinicians, as we stay by the bedside or as we work with in a clinical setting, there are others out there who are researching. They're researching and they're gathering facts and studies that are proving some of the things that we might be doing, that there can be improvement with that. So we should stay current, continue our education. I embrace that. Go to seminars, listen to seminars, go to seminars, listen to webinars. Of course, go on YouTube, pick up some of the ideas that are out there. There's so many as we advance in this training. And of course, leadership symposiums, and stretch yourself and network with others. That's so important. Maintain a positive attitude. You can be a brilliant person. You're so bright. But if your attitude does not align with that, then you're not going to be as successful. So be intentional about making your path on your path positive, so that as the other nurses are seeing you, they would want to emulate some of those characteristics that you display. I won't be long with you, as you might be hearing in my voice, but I just want to say happy holidays, happy Christmas, happy Merry Christmas, whatever you like it to be termed as. But be helpful, be helpful, be healthful, and take care of yourselves. It was really nice working with you through 2024, and I will continue doing my best on YouTube and on your podcast. Now, if you haven't received your book, Nurse, the Guide to Empowering New Nurses in the Delivery of High Quality Care to All Patients, I think you should get your copy. Get a copy also for one of those new nurses that you know, and get a copy for yourself, a refresher. As I spoke with a nurse recently, she said, Miriam, I'm telling you, I am reminded of some of the things that you have. Another man said, who I haven't spoken to with a long time, and she said, your book I put it down when I'm ready. So I'm happy that that has been impactful to others. And if you have others in your audience who you'd like to share, and maybe some of you online might have been my student or my colleagues, and you want to share with others, this book is on Amazon and it is a bestseller. So I need you to get your copy. And I would like you to share some of the thoughts on the rating. You can go on the rating and look and see. It's also an ebook, and I also have the paper cover. So, and it's from my heart, and it's from my experience, and I've done research while doing it. So I would like you to get your copy. If you're in the New York area, definitely I can sign that for you. You just have to DM me or put it in your YouTube. So I'm going to say Merry Christmas, helpful and happy New Year when it comes. Thanks for listening. Thanks for being my audience today. I appreciate you.